Good morning. Thank you for inviting me today to share our research experience with small construction contractors. I want to present today two projects or two perspectives that I had been working in the past years. So the first part of my presentation is about the results of the training elements of an intervention that we develop for Hispanic workers or Hispanic contractors here in the United States, in Massachusetts. And in the second part, I want to share the model that, or the way that small construction companies in Colombia, how they get access to training according to the workers' compensation system in Colombia. So yesterday, Dr. Ringen talked a lot about the construction industry, so I am not going to discuss this in detail because he did a very well description of the conditions and characteristics of the construction industry. What I want to mention here is how small contractors, what is the role that they play in the construction industry. So basically, when we talk about small contractors or companies with 5 or 10, 20 workers, usually these are subcontractors. And this has an impact in the ability or the capabilities that these companies have to make changes in their workplace when we talk about safety and health. If we think about the hierarchy, the organizational hierarchy in the construction industry, subcontractors, they are at the lowest level in a construction project. And this also is attached to their lower latitude to define how to do the job or what kind of safety and health measurements they can include in the way that they perform the job. So there are several or a good number of studies about the limitations that these small contractors have in terms of financial and human resources, right? So we know that usually they work with a very small margin, profit margin, and in these small contractors, usually, and it's typically, we don't have a person first just responsible for safety and health, and when we have this person usually don't have the knowledge just to apply in the workplace, and the knowledge that would be similar to the level of risk that these small contractors faced in their workplace. The other part is about the perceptions that most of these small contractors have regarding safety and health. And sometimes it's not only the perception, it's true for them that safety and health, apply the safety and health regulation at burden for them in terms of financial and personal resources. So what I want to mention here, and when I want to talk, is about a project that we conduct a few years ago here in the United States, in Massachusetts, in a town called Lawrence, that is more or less 75% Hispanic population. So we call this project Protección en Construcción, and this was a community-based participatory research that later, when I present how we recruit contractors, so you will see the importance of this type of research just to reach these small contractors. So that was partnership with the City of Lawrence, with a union, community organizations, and the University of Massachusetts Law. The main goal of this project was to reduce fall hazards and silica exposure in residential construction among Hispanic workers. And we know that the rationale behind this kind of project was the high injury rates that Hispanic workers experience here in construction. So the first phase of our project was just to conduct a series of focus groups with construction workers, with Hispanic and non-Hispanic workers, with supervisors, with owners and managers in this field. So we want to explore and examine what kind of barriers or what kind of challenge they face every day in the workplace. And this is pretty much what we know here. And about that, they experience greater production pressures when we compare them to their non-Hispanic counterparts. And there are a lot of elements behind this. So they also talk about the lack of training or the lack of appropriate training according to the type of a job that they perform. So they mention a hostile environment in terms of the relationship, worker-to-worker relationship, and worker-supervisors relationship. And some of them, they expressed that every time that they talk about safety or the deficient conditions that they experience significant fear of retaliation, right? And if we connect this with the need for the job, we can start to understand the difficulties that they have to express or to speak up about the poor condition that they experience. So we learned this, and our original idea was to design, so part of this intervention was a training component focused on Hispanic workers, right, in the construction workers. So once we have all this information and we analyze this, so we identify that the supervisors, they were the key people, the target people to develop this kind of intervention. So we changed our mind, and instead of working or training workers, so we move and we develop a program just focused on supervisors for many reasons. Because they were, so the connection with workers, right? So they have their, in some levels of authority and power to enforce safety behaviors. They could be, with good kind of training, they could be good trainers for the workers. And for one reason is that in small companies, supervisors, they are almost the most permanent employee in the workplace. If we were planning a sustainable intervention, so supervisors, they could be the key people to develop or to address this kind of intervention. So we conduct this with this information and safety climate survey that we conducted in this area. So we came up with an intervention framework based on supervisor and focus on elements that we identified as modifiable in this construction environment. And we developed this, component, the training component of this project was, this was a 5-hour training program for supervisors focused on 5 elements that we thought were modifiable. So we identify content, that how to help supervisors to balance productivity versus safety. So we include elements to improve hazard recognition and pre-planning. In terms of social support, during the focus group, we identify deficiencies in communication between workers and supervisors. So we include this element here. We include also a module about how to communicate with Hispanic construction workers. And something that we call respect the workplace, because that was one of the more common comments when we conduct the focus group, the lack of respect. In terms of training, our goal, so in terms of training in this module, our goal was to provide the supervisors with the tools that they would be able to train their workers. They would be able to conduct and to integrate workers in conducting job hazard analysis or toolbox talks. In terms of roles and responsibilities, so we include information. So content about hazard report, workers' participation, and some tools to just being effective trainers. And in terms of protective equipment, so we use the regulation in terms of fall protection and respiratory programs. So this was our program. And until here, this was the easiest part of our project. So the next part was to put this program, this training, in the hands of these small contractors. And that is that we use our community-based participatory approach to do this. So we have part of our project personnel was an outreach team. So this was comprised by members of the community. So I mentioned before that this was developed in Lawrence, Massachusetts. So we work with some members of the community. So here we have our members. We trained them in general in terms of the characteristics of the construction industry, obviously in the principles of community-based participatory projects, and technical aspects, basic elements of fall prevention and silica exposure. So they were key in our project because they knew the area, they knew the town, so they were able to visit in the morning or in the afternoons of during the weekend barber shops, for example, just to recruit contractors, to recruit supervisors. They visit very early in the morning Dunkin' Donuts, just to meet with a contractor that they were with their crews there, right? So they walk around the Lawrence area, just looking for projects, for residential projects, for contractors that they were working at that time in any of the areas. And they talk with this contractor. So they have the opportunity to talk to them, to present the project, and to invite them to participate in our project, right? So that was very important for us and was a very key element to incorporate these contractors in our project. So we also here, we work in partnership with local lumbers. And why? Because small contractors, small construction contractors, they almost buy their supplies every day. And they buy these supplies in these local lumbers, right? So we contact the managers from these lumbers, and we had the opportunity to install a table with all the material that we have and all the information to give this information, but also to invite them to participate in the intervention and in the training program. So we conduct, we also talk to the vocational schools in Lawrence when they have supervisors, construction supervisors attending the training programs that they had. And we were able to present our project and invite them to participate in this project. And we also work with a building trade association. So this was very important too, because this building trade association, or at least this particular one that we worked with, so they had monthly meetings. And this is a mix of social and training meetings. So they have barbecues and this, but also they have 1 hour or 2 hours of training. So we were able to use those hours, 1 or 2 hours, to just train them in our modules. So we attend these meetings for several months just to present these modules. So these were some ways that we use to recruit these contractors. We also publish some articles in the local newspaper. We had interviews in the local TV channel, so in the radio station. So we have the opportunity just to present our project in different ways. So once we have this, so we have to deliver our project. And as I mentioned, so we work with these numbers, and we conduct the training in the Lambert's facility. Why? Because construction contractors, they go there so they can attend the training and buy whatever they needed, right? But also here we use active learning strategies. And not only because they were adults, just because something that we identify was that a lot of these contractors and subcontractors, they knew about the standards, they knew about the regulation that they must apply in the work site. It was not, most of the time, a lack of knowledge. Most of the time was a lack of knowledge about how to implement, how to apply these standards in the workplace. So we invite some fall protection suppliers to demonstrate, to do hands-on training on how to use this equipment, what kind of equipment, according to the task that they developed, they perform it, what kind of equipment would be appropriate for their particular task. They have the opportunity to talk with these suppliers, different suppliers that they have this. Also, we conduct classroom session with the small groups. Sometimes we have just one company, people from one company attending this class, or just people from different companies. So they, in the classroom, we also brought the equipment, and they were able to try. So here, for example, we identify a couple of supervisors that they mentioned that it was the first time that they try on a harness. So they talk that every day they reinforce the use of harnesses, but they never, ever wore one before this. So we, that was, was of the strategies. But we also use material available in our training programs, right? So there are a lot of good material there, right? In the OSHA website, in the NIOSH, other researchers that work with this material. So we incorporated this material in our training modules. So we use, for example, the V-Tools, that is just 3-minute video to talk to supervisors about how to conduct a job hazard analysis, but also to train supervisors how to use this material for training their workers. So we designed some material, but we tried to use material that was available for contractors there. Because once we just conclude our project, we thought that these contractors, these small contractors, they should be able to find this kind of material. So to go to the source and identify what kind of material would be good for them. So we use the fall protection guideline from the OSHA. So we, in the package that we gave to them, they have copies of all this material, hard copies, CDs, flash drive with all this material. So, and we work with this guideline, and we have the opportunity to discuss in our sections how to apply this material. So they were able to ask about what kind of a system would be good for them. So this was an interaction with them all the time. So at the time of our training, just OSHA came with the fall prevention campaign. And we incorporate this campaign in our training too, right? So we were able to just use all this material from OSHA and just gave them this material. And we conduct meetings, so the contractors, these small contractors, they were able to have meetings with the people from the OSHA consultation program to talk about all the services that they can get access through the OSHA consultation, not only when they have citations, but also in a proactive way, just to understand how the OSHA consultation program works. With the OSHA office in Lawrence, we work with them, and we invite them to talk with our with the contractors, with these small contractors. So people from the OSHA, from the local OSHA office, they came to these meetings to talk with these contractors. So we have a couple of meetings with them, and in the first meeting, so only one, I think, very brave contractor showed up to talk with OSHA, right? So after that, we changed our marketing strategy, and we invited, and we have 3 or 4 contractors later just to talk with OSHA. So also, in order to give contractors tools that they can use, all of our material was available in English and in Spanish, but also we put together this fall prevention equipment catalog. So what we put here was information about the type of fall prevention equipment that they could use in their workplaces, and where the local stores that they could buy this equipment, right? So we put pictures here, what they needed, and this was available at the local store. So additionally, so I mentioned that this was a 5-hour training program. So in Massachusetts, supervisors, construction supervisors, every 2 years, they need to renew their supervisor license. And they need to take 12 continuing education credits, right? So we work with the state of Massachusetts, and we got approval for our 5-hour training just to be part of these 12 hours that a supervisor needed, right? So these 12 hours is very expensive for a supervisor. This could be around $1,000, $1,200 for these supervisors to pay for this. So we offer these 5 hours for free. And they attend them, they receive a certification, and that was part of the 12 hours that they needed to complete in a period of 2 years to renew. That was good. And once we finished this project, so the trader, the association, the Building Trade Association, so we train the trainer. So they took all the material and they offer the same program just for a reduced price. We also work with the stakeholders here, and we create this brochure for homeowners, just to tell them that when they hire a contractor, what were the minimal safety standards or rules that these contractors should follow. And we work, I mentioned that we work with the city of Lawrence. So this brochure was attached to the permit where the contractor or when a homeowner came to the office, to the City of Lawrence office to pull the permit. This brochure was attached to this information. So we include them, and we wanted that they were informed about all this. Basically, so it's not too much information that you can put in a brochure, but it's information that could be helpful for homeowners or other contractors that they don't have too much resources. So these are just samples of what we did with these small contractors. And we measure, this is just few information, this is training. So we measure knowledge, attitude, and skills in these contractors. So we trained over 100 contractors, and we did pre and post. Not all of them attended all modules, but what we found here was some changes in terms of knowledge. We found an important change in knowledge about silica, and I think that one of the elements here was that when we were in this the module about silica, a lot of contractors, they talk about silica and asbestos as the same material. So it was something that they mentioned when we start to talk about silica. They say, yeah, I know about silica, and they started to talk about asbestos. So I think that this is why we have here a good improvement in knowledge. If you see safety planning here was in terms of knowledge, they didn't change the knowledge to the training. But I want to jump here, in the skills. So we use, as I mentioned, all these learning strategies, active learning strategies. And in terms of planning, they identify, so what they respond in our pre and post survey was that they identified that they have skills, more skills to put in practice these pre-planning elements or tools that we discussed with them during the training. So in general, this was just some of the elements that we use for the training module in this intervention and in Massachusetts. And let me move now into the experience from Colombia. So the construction industry in Colombia is not different than the construction industry here or in any other part in, I think, in the world. So we have the same issues, small and medium construction companies. And in Colombia, a small company is considered a company with less than 50 workers, right? If we think about construction, a company or a contractor with 50 workers is a large company. It's very difficult for a contractor to have 50 workers and have work for them and all these things. We experience the same high severe and fatal injury rates. This is in general not something different. So I conduct a safety climate survey with small contractors in Colombia, and I want to bring only this part here, that this is the elements that they score higher in this safety climate. The elements related to training. So workers, this is only workers. So workers in these companies, they identify that training was an important element to prevent accidents or to, was an important element in terms of their perceptions about the importance of safety. And I bring this here because I want to show you how small companies get access to training in Colombia. So in Colombia, the workers' compensation system is pretty much what we have here, with some important differences in terms of workers. They receive 100% of their salary when they have an work-related injury or illnesses. But what I want to mention here is that it's mandatory for the workers' compensation insurance companies in Colombia to provide safety prevention and health promotion services to their policy holders. So it's part of the legislation, it's part of the regulation of the workers' compensation. And this is free of charge, so they don't have to pay additional cost for these services. How they provide these services is basically through consulting and training activities. So the workers' compensation insurance, they have a group of safety and health specialists that they attend. They go and help these companies to implement the safety and health programs and train workers. So this is a very important resource for small contractors, right? Sometimes it's just the general contractors The general contractor, they are a policy holder with a workers' compensation, and all the contractors and the subcontractors are part of the same, so they are policy holders from the same workers' compensation. And this helps to distribute the resources for all these companies. So that's a kind of balance between the premiums, the return that small contractors could have in comparison with a general contractor that they have a lot of, they have a good return services in this. So what kind of training these small companies may receive? So one is compliance, so how to be in compliance with regulation is part of the training that they receive. So the workers' compensations, workers' compensation companies, they also have different levels of training. So they have a specific training topics for workers. They also have, they know that small companies don't have a person in safety and health, so they call this a safety leaders training. So they talk with the company and ask this company to send one of the workers just for this training. So over a period of a year, the training program, the workers' compensation training program, has different training sessions, and workers, they can complete this training, and at the end, they can receive a certification that they are leaders in safety and health or different elements. And they also have training for supervisors and owners. So, as I mentioned, this is not, they don't have to pay extra for this. And this is very important for these small companies. So these are on some of the topics. They have technical and soft skills, and it's part of the regulation that the workers' compensation have to design health promotion training and programs for these companies. But they have some, but the main focus is in the safety and health part. So this is a regulation from 2012. So the equivalent to the Department of Labor in Colombia, they issue this regulation about fall protection. And was in this regulation was mandatory for employers to provide fall protection equipment, training, occupational medical examination, and surveillance for all those workers that they were supposed to work at heights, right? So in this regulation was not allowed to the workers' compensation company to provide this training. That was something that the companies, they had to pay by themselves. But the government allowed or worked with a government education agency to provide this training for small companies. So small companies were able to attend the training, the required training through this agency and train their workers, the competent people, and the administrative people responsible for the program. This took a lot of time because you can imagine a lot of people just trying to do this. But I think that it still is a very good resource for these companies to do, right? This is, so part of my research in Colombia was to interview workers and supervisors in managers in these construction sites. This is some quotes from the same company. So I interviewed first workers and then the manager, and both they told me about training experience that they have, how they were able. Think about that construction workers, they have low education levels, right? So, and attending this training about all these conditions that they need or requirements for fall protection, it's hard for them. It's hard for us. It's hard for them too. So they attended this, and it's a requirement to take an exam just to receive the certification. So 2 of these workers were not able to approve the exam, but this is a small company. I think that they were maybe 20 workers. So and I think that was good when the manager in this company was able to identify this and just provide extra training for these workers just to approve their training. There, recently in May 2017, so the Department of Labor there issued a new regulation that is mandatory for all small companies to implement a safety and health management system. But it's part of the regulation, it's part of this legislation that the workers' compensation insurance companies, they must train these small companies in how to implement this program. So they need to provide 50 hours training, that could be through e-learning or any other face-to-face, 50 hours training for these companies. And in addition to this training, the workers' compensation companies, they must provide consulting services to these small and micro companies in safety, how to develop the safety and health policy, how to design the hazard identification and control program, emergency preparedness, and incident investigation, among others. So it's supposed that if the inspectors or from the Department of Labor, they don't go too often, but if they identify that a small company doesn't have this system, they have 2 years to implement this. If a company in 2 years doesn't have the system, the safety and health management system, they can put penalties for the company, but also for the workers' compensation, because it was a responsibility of the workers' compensation company to provide this training. So I think that it's important for our small companies to have resources at different levels to have regulations that help them to implement these systems, information at the company or at the supervisor level that would help them. So to conclude, so I want to say that I think that there are a lot of material outside that we can use to improve our training or to just make this material visible for these small contractors. Sometimes as researchers, we think that we need to start and create everything, and I think that there are a lot of material that we can use. So we think that it's important, particularly for these small contractors, just to try to bridge the gap between the knowledge that they have about what to do and how to do it. So through training or through other strategies, we should be able to help these small companies to bridge this gap. So and try to be coherent between the knowledge that we provide and the tools that they can use in the workplace just to reduce risk. And every time that we would be able to identify additional benefits for these small contractors, always will be very useful for them. They still think that safety training is a burden. And if we identify kind of benefits that could help them to conduct the training, to implement these programs, and have additional benefits, would be good. And yeah, we have talked through all this conference about adapting to the realities of small contractors. And this requires time to understand how they work, what kind of problems, what kind of barriers they experience. And we spent almost a year and a half just trying to design this training program and working with these small contractors to identify these elements. So this was the information that I wanted to share with you today, and I open to questions if you have.
Morning.
Morning.
Thank you for the great presentation. I have a few comments. You point out the significant fear of speaking up, which is true. And based on what I found on my research, there's two reasons for this. First thing, their previous experience. They can get fired if they speak up.
Mm-hmm.
The second thing, their immigration status.
Yes.
So even if they speak up and they go to OSHA, the system in the United States will not help them because they don't have Social Security. And they aware of that. So I think the OSHA regulation, current OSHA regulation, is not friendly to our Hispanic workers, construction workers. And this is a huge problem. We need to take care of it. Second thing, you mentioned the safety leadership, very important. However, again, based on the focus group, one of the focus group I did, I bring the supervisor with Hispanic workers. And the supervisor was so surprised that their workers not speak to them. They said, why is that? What's going on? If it's unsafe, just tell me. But they don't speak up again because their previous experience and immigration status, some of them. Therefore, the construction supervisor in the United States, they are not aware of the social environment of Hispanic workers. Even if they are aware of it, they are not really aware of the influence of their social environment. Therefore, I don't think there's training material for construction supervisors to make them aware of this problem. They don't speak up because there's some issues. We need to communicate these issues to our construction supervisor. I don't think there's training material to address this problem. Second, the language barrier. Language barrier is huge, is huge. And some of them, I visit a work site, the workers, they cannot speak English and they cannot read Spanish. So even if I translate the material, it will not serve nothing because they cannot really read. So this is important. For that, we need to hire leadership bilingual. Mm-hmm. It's not just bilingual, must have some leadership skills so they can really address these questions. So this is just my 5 cents. Very great. Thank you so much.
Thank you.
Thanks.
I want to say something about these language barriers. So what we found during the focus group is that workers, they identified language barriers as a problem, but not as the main problem in the construction site. So they mentioned that always they have a translator or somebody who help them with this information. And the other part about the social environment of Hispanic workers, and I don't know, I have a position about when people mention that workers, Hispanic workers, they work hard because it's part of the cultural value. I don't think that is part of the cultural value. I think it's part of a kind of survival value, right? Because if you are an immigrant in this country, you don't speak the language, you have an immigrant status that doesn't allow you to speak up, and you don't have mechanisms to speak up in the workplace, how you are going to find another job if you are fired from this job, right? It's not. So they need to work hard, not because the culture. They need to work hard because they know they don't want to just be visible for something different than working hard, right? Immigrant worker with an undocumented status is the person who doesn't want to be injured in the workplace. So it's not that, it's just they don't want, because they don't have ways to bring income. Sometimes they don't have health insurance. So they don't want to be injured in the workplace, right? So is part of this. But thank you for your comments.
Very nice presentation. Thank you.
Thank you.
I should probably know this, but I don't. But the first project you talked about in Massachusetts, is that training still happening in Massachusetts or elsewhere? Or is it available? Is the model available online for other people to adapt it?
So we did train the trainers, and so we had people from the building associations, and people, even we include some people from the Brazilian Immigration Center. I understand that they are still working. I don't have numbers or evidence how far this project, this training is now, but I understand that they are conducting this. Thank you.
Hi, thank you for the great presentation.
Thank you.
I'm curious, I do a lot of safety consulting and training in the construction side, and at least in the Northeast area, we run into a lot of the contingent laborers, the day laborers who are picked up in parking lots very often for roofing jobs or whatever. Very often the legal status may be somewhat questionable, which of course, as you said, fear of retaliation comes into play. But in terms of the interventions on how to carry that safety message, the employers who are picking these people up are calling them independent contractors.
Mm-hmm.
So very often they're not indoctrinating them in terms of training and safety. I had one matter I was involved in, 2 guys fell off a roof, and the employer didn't even know their names, you know, that type of thing. So of the various interventions that you discussed there, what do you think is the most effective way of reaching, especially the Hispanic day laborers and contingent workers who aren't going to be going through formalized in-house safety training programs?
This is a very hard question, but in the panel, the discussion panel yesterday, the person from the farm, I think that she mentioned about mechanisms internally at the company level. So I think that we need to work at the company level and at the regulation level to improve this. So the workers, they don't have the authority and the power to make changes. So we can train them in many aspects in how to deal with hazards, but they don't have authority and power. So we need to find people, or the supervisors, sometimes the supervisors know this, but they are able to make some changes. So I think that is just at the management level, even in these small companies, try to identify how this could help them and open mechanisms to allow, in general, workers to speak up about this. So it's just, I think that workers, training workers is just one piece in this puzzle, but we need just a structure that allows these workers to apply their training. When they receive the training and they go to the workplace and they are not able to apply this. So they mentioned this many times, that they receive a training about the right ladders for certain tasks, but when they go to the workplace, they didn't have those type of ladders. So, but if we have supervisors, managers, or even owners, I think that they need to understand what kind of material or equipment they need to bring into the workplace.
Final comment. Yeah, final comment about the language barrier. I'm aware of Cora, I believe.
Yeah.
She did focus group back in 2011, and she suggests language barrier is not real. Is not real a good factor. But based on my findings, language barrier was there. So everyone said, we cannot speak up. We cannot talk the language or something. And I did a few investigation. I found this study sample for Cora, all of them from Puerto Rico. Mm-hmm. I'm not sure if this may have an impact on the results, because the majority of Hispanic workers in the United States are from Mexico. So this is maybe something for future research to study, because there's different results. And I'm not sure if the study sample affect the results.
Yeah, we have Dominicans and Puerto Ricans.
Yes, exactly.
And yeah, language barriers, since that language is a barrier when you try to talk about safety and health, but it's not a barrier when you hire a Hispanic worker, right? So you can talk about how much are you going to pay you, what is the schedule do you have to be here, what you have to do. But when you talk about safety and health, it shows up as a barrier. So I don't know. Thank you.